This video is going to go over the directions and the parts of the skeleton. So I have my friend here to help me demonstrate. So the axial skeleton is the first one on your list, and that's going to include the skull, the vertebral column all the way down to the sacrum down here. So that whole vertebral column, the ribs, and the sternum. It's not going to include the shoulder, it's not going to include the arm, it's not going to include the pelvis or the leg. So the axial skeleton is just this bones of the trunk, so this torso region, as well as the skull. Now the appendicular skeleton, that's going to be the bones of the limbs. So we're going to have the shoulder joint, both the scapula and the clavicle, and then the arm all the way down to the hand. And then in terms of the legs, we're going to have the pelvis without the sacrum, so it's not going to include that, the back of the pelvis, just the os coxae. And then it's going to include the lower limb, so the leg all the way down to the foot. That's going to be the appendicular skeleton. So axial trunk, appendicular limbs. Now we're also going to be looking at directions. So we use directional terminology, always referring to the body as though we're in this position right here, what we call anatomical position. And basically it's just a vertical, hanging or standing skeleton. But the key is that these palms are facing forward right here. So the hand is facing forward, meaning that the thumb is going to go to the outside, pinky is going to go to the middle, so palm forward. So that's anatomical position. So the first set of terms is going to be just a trunk term, and that's going to be superior and inferior. So superior means towards the top, inferior towards the bottom. The other thing we can use those terms for is if we're looking at, say, the skull, here's the superior view, here's the inferior view. So top view, bottom view. All right. So, let me get him caught. There we go. So, another way that we can use those terms. Next set of terms is going to be anterior and posterior. Anterior means to the front, posterior to the back. So again, here's the anterior view of the skull, and if I turn his head around, here's the posterior view of the skull. So anterior front, posterior back. Next set is medial and lateral. So if I cut the skeleton in half right down the middle here, anything that's towards that midline, towards that middle here, so I'm going to step behind him for a minute. So towards that middle here, that's going to be medial. Towards the outside, out here, that's going to be lateral. So if we look at the hand here, when we look at the hand, we can see that the thumb is going to be lateral, whereas the pinky is going to be medial when we're in anatomical position. Another thing we can look at is the knee. In the knee, we have two joint surfaces. We have the medial one and the lateral one, so that's ways that we can differentiate those. Last set of terms is proximal and distal. Now these terms are only used on the limbs, so the arms and the legs. Proximal meaning close to the body, distal meaning further away from the body. So on our humerus here, our upper arm bone, this is the proximal end because it's close to the trunk, whereas this is the distal end because it's further away from the trunk. So to recap, we have superior up, inferior down, anterior forward, posterior back, medial towards that midline, lateral away from that midline, proximal towards the trunk along the limb, and distal away from the trunk. Axial skeleton, skeleton of that trunk. Appendicular skeleton, the skeleton of the limbs.